Hi. Thank you for that lovely introduction. Okay, so today I'm going to tell you lessons from the boonies to biotech. So this is my first HealthTO event, but this isn't my first experience with the Toronto healthcare system. I was actually born just across the street. So to introduce myself a little bit, I'm going to take you through a very quick timeline of my experiences and how I got to where I am now and some of the lessons I've learned along the way. So like I said, I was born across the street, but I didn't grow up in the big city. I grew up in the country, out in the boonies, in Niagara-on-the-Lake, on a peach farm actually. And then I transitioned into the academic world and fell in love with biomedical research and biotech. And I recently finished my PhD at the University of Toronto, where I was developing technologies to improve cancer research. And just 6 weeks ago, so a month and a half ago, I started here with Phenomic AI. So we're an exciting new startup here in the JLab space, and I'll tell you more about that later. But at the six-week mark, maybe I don't have the best lessons about biotech, but I'm hoping you'll find some of my interesting lessons throughout my life. Can be applicable to almost any kind of situation, especially in these industries. So first, I'm going to start with a lesson from my early years. So when I was growing up, I always wanted to be a medical doctor because I was so interested in curing disease, and these are the people I really saw as curing the disease. But I grew up on a peach farm, and so my job was actually to pack peaches. So we would bring in peaches from the field, and I would put them into baskets and arrange the nice peaches. However, a lot of peaches actually have blemishes on them, or bruises, or a simple mark, and this was a real problem. We would have to discard these peaches, and because we were kind of a small family business, we didn't have anything else we did with them. So I saw this problem, and my solution was, I'm going to become the first cosmetic peach surgeon in the world. So basically what I did was I would take a donor peach, and I would match the skin tone, and I would extract the bruise or the blemish, and I would replenish it. And so from one peach, I could cure 20 peaches. However, does anyone see a problem with this? Any problems? Yeah. So obviously the peaches would rot, and these were unsellable, and all I did was destroy peaches. But the lesson here is that you don't have all the answers yourself. So I was about 10 years old when I did this, so don't think less of me. And I didn't really have access to the internet because this was a long time ago. So no internet, and I didn't have access to scientists. So I knew a little bit about aseptic technique and that maybe I introduced some bacteria. But what I didn't really understand was that peaches aren't patients, they don't regenerate, they're not healing, they're just gonna fall apart. So the unknown unknowns. So I knew some unknowns, but what I didn't know were the unknown unknowns. And so that's the lesson I really took from this early lesson, is that had I worked with someone who could have told me, hey, this was a terrible idea, maybe that would have saved me time and effort. But I digress. So I transitioned from farm life to academic life, and I went to grad school. And I did this because during my undergrad, I decided, I kept asking questions, how does something work? Why does it work? How can we change it? Can I fix it? Why didn't my peach experiment work? So I went to graduate school, and there I had some successes and lots of failures and lots of learning experiences. And so basically, the major lessons I learned there would have to be about, first of all, formulating the right big picture goals. So what do you want to do? What's going to make you special and different from the grad student next to you or the company across the street or whatever? You have to have a really good big picture goal, and that goes back to my earlier thing. Maybe your big picture goal isn't the right goal about peach surgery. And then keeping the big picture goal always in mind, you have to have a route to get there, and maintaining flexibility on these smaller picture goals is a really important thing as well. So during my time in my PhD lab, the CRISPR-Cas9 technology was applied to gene editing, and we were in a sort of a gene editing kind of lab and using a different technology that became obsolete. So we needed to stay at the forefront of that. So just because you've got a plan and a best solution now, you have to stay always open to the newest thing coming in. And the best way is the best way, and the only way you figure that out is by talking to other people with different backgrounds and always bringing that in. So that brings me to my final sort of point from this, is building the right team. I didn't do anything in my academic lab all by myself. I built collaborations with other labs who had an expertise in something else, and then we brought this together and we all learned from each other. So this is essentially the academic experience, but I found a lot of the same things in transitioning to industry. And so I put up these two pictures here to summarize maybe the cliches about academia and industry. I don't know if any of you are in academia or industry, but you may have heard this. In academia, it's very prevalent. We have, it's pure science. We have intellectual and creative freedoms. We can follow where the data leads us. But we struggle to get funding, and we don't have enough money, and tenured faculty positions are rare and difficult to come by. Whereas in industry, well, looking at this picture, it's more rigid. You have a clear goal. Sometimes it's a negative outlook, but really you have more funding. You're paid more, and you can really have a targeted focus and bring something to market. And there's also drawbacks to that, in that if you find something along the way that's interesting, maybe you can't really do that. And so the reason I put these up here together is because I was actually lucky enough and had the pleasure of working in a lab that kind of walked the line. So I found myself working with my tax and sponsored research agreements to bring these two entities together to try to get the best of both worlds. So I think really together it can be really helpful. And I saw this firsthand, just to circle back to my Peach story, firsthand, where we would present some data that we as academics were excited about to somebody with a different perspective, a clinical perspective or a drug development perspective. And they would come and say, oh, well, that's great, it's interesting, that won't work that way because of some unknown that we were never going to be aware of no matter how many papers we read, because we didn't have that experience bringing that in. And conversely, it works the same way in industry, finding scientists or researchers, clinician scientists, someone who's developed a really good model system. They're working in kind of the same space as you, but they've obviously put more effort into going on side trails, and they've learned a lot of lessons from that, and that can save lots of money and time on both sides of the story. So I would be remiss if I didn't mention the company I'm working with now and what we're doing and how this is all kind of coming full circle. So I'm with Phenomic AI, and basically what we want to do is to seamlessly integrate artificial intelligence, deep learning, neural networks type systems with the experimental biology and stay on the cutting edge the whole time. And so just to break down the name, for those of you that might not be biologists, phenomic is a portmanteau of the word phenotype and omic, which is a suffix that's a general catch-all for anything that's a totality. So genomic is all of the genes. So all of the phenotypes. And what a phenotype is a feature, I don't know if this is a laser pointer, but it's a feature of a cell that is observable, or an organism that is observable. So you can think of this as a fingerprint of the cell, as shown here in this lovely Nature Methods cover story. And what we want to do is to read out a healthy cell versus an unhealthy cell with clinically relevant phenotypes, things that will help translate drugs into some kind of actual clinical outcome rather than taking a target-based approach, which I won't get into all of the details of that, to make an unhealthy cell healthy in clinically relevant contexts using excellent model systems and really great AI. And the way that we're really doing this is by building a team that works very closely together. So there are other companies in the space, but they tend to separate their AI people from their experimental biologists. And we think it's really important to keep this together and make it a very iterative process where everything is sort of more of an organism. So we have a team of brilliant software engineers, different machine learning experts, programmers, researchers, biologists, and thought leaders in biotech and drug discovery, all working together. So that's all. I want to thank you all for listening and for inviting me here. It's really great to be among this innovative and diverse group. I'm very honored. So please feel free to reach out to me or any of us at Phenomic AI. We're here. They're over there. Wave. In person. I don't have pictures, recent pictures. We're still getting everything going at the 6-week mark. And we have a Twitter and our website, and that's all. Thank you.